Hello everyone, in this video we will discuss about fulminant hepatitis. So fulminant hepatitis is also known as acute hepatic failure. It is also known as fulminant hepatic failure or massive hepatic necrosis. So by this word massive hepatic necrosis you can understand what goes in fulminant hepatitis. So what goes is there is a massive amount of necrosis which is happening in the liver. Fulminant, if you go by dictionary meaning, it means explosion. So this is a very acute and a rapid process which is happening. So this is a very uncommon complication of acute viral hepatitis and has a very bad prognosis. Now what happens is because the liver is going into hepatic necrosis and it is in massive quantities, so patient can progress from onset of symptoms to hepatic encephalopathy in 2 to 3 weeks. Now the duration is has to be acute in case of fulminant hepatitis. Now the prognosis is bad, but the also liver can regenerate after massive necrosis if the connective tissue framework is intact. Now firstly we will discuss about the causes, then we'll go to the morphology. Okay, now firstly what are the causes which can lead to fulminant hepatitis? A very important causes is viruses. So any virus which is known to cause hepatitis, whether it is hepatitis A, B, C, they all can cause fulminant hepatitis, but the most common one is hepatitis B. Now dengue virus can also cause hepatitis, fulminant hepatitis. In drugs, a very important drug which causes fulminant hepatitis, and also if there is poisoning or overdose of acetaminophen. Okay, so this acetaminophen can cause fulminant hepatitis. Other drugs are carbon tetrachloride, halothane, isoniazid and rifampicin, the two anti-tubercular drugs. These can also cause fulminant hepatitis. Acute fatty liver of pregnancy, hepatic vein obstruction, hyperthermia, ischemia tumor, Wilson's disease, these are other causes which can also lead to fulminant hepatitis. But the most common causes are the viruses, and second is the drugs such as acetaminophen, and certain herbal drugs are also known to cause uh, fulminant hepatitis. Now going to the morphology. In morphology, firstly we'll discuss about the gross, what is happening in the liver, then going to the we'll go to the microscopy. So grossly it will depend upon the causative agents, but because this whole is leading to necrosis, uh, they will have identical morphological changes which will vary according to the severity of the necrotizing process, because whether it is hepatitis, whether it is any drug which is causing, they are at the end leading to necrosis of the liver. So necrosis has a typical appearance, so they have identical morphological changes. So grossly you can see either the entire liver or random areas of the liver can be involved. With massive loss of the mass due to massive necrosis, sometimes the liver can shrink up to as little as 500 to 700 grams and can become a limp red organ. So liver has a capsule, so when the organ is becoming is shrunken down, so what will happen, the capsule will be too large, it will be covered by a wrinkled too large capsule. And if you transect this area, if you can take a cut section of this area, you will see there are necrotic areas. Now these necrotic areas can will have a muddy red mushy appearance with hemorrhage. In this diagram you can see, in this gross appearance of the liver you can see this is not a normal liver. Okay, you are seeing these are the areas of necrosis over here. So there is a muddy appearance, there is a necrotic appearance. You are if you see it, you can you will see that is a necrosed liver. It is a dead part, it is a dead area of the liver. Okay, so it will have a mushy appearance, muddy appearance, will be red in color, will be uh, not resembling the normal liver. Okay, so now going to the microscopy. So microscopy, we already firstly know what is happening is the necrosis. So if necrosis is happening, there will be complete destruction of the hepatocytes in the lobules. So their hepatocytes are present in lobules, so there are complete destruction of the lobules. Only thing which you can find which is preserved are certain portal tracts, you can see certain bile ducts, you can see, which are preserved, but otherwise the hepatocytes, they are completely destroyed with collapsed reticular network. Okay, so this is the connective tissue network which is there of the liver. So reticular network, it can also collapse due to this necrosis. You can find inflammatory reaction and ductular reaction also. So inflammatory reaction, you can see the infiltrate of the inflammatory cells. Then in ductular reaction, what is it? Sometimes you can see there is proliferation of the ducts due to this massive necrosis, so that is known as the ductular reaction. Going to, this is the microscopic picture which shows the massive necrosis which is happening in the liver. So you can see here and there are certain viable hepatocytes. So here you can see there are certain viable hepatocytes, uh, although they are not present in proper cords. Okay, but you can make it out that it is a liver, it is a slide of liver. uh, Here are also random hepatocytes we can see. Otherwise you can see whole of this area is necrosed. So this is known as pan-acinar hepatic necrosis with collapse of reticular network. This is characteristic of fulminant hepatitis. Now going to regeneration. So uh, after fulminant hepatitis, also regeneration can take place. Then regeneration takes place from stem cells which are present in the canal of herring. They are known as the oval cells, and this leads to a reaction known as ductular reaction. Okay, now ductular reaction can regenerate both hepatocytes and bile duct cells. Now it will vary, the regeneration is taking place, but it will vary according to the condition of the liver. So if the parenchymal network is preserved, the regeneration can restore the liver architecture. However, if the parenchymal structure is destroyed, so it will lead to nodular masses of the liver cell which are produced, which will produce a very irregular liver on healing. Also, sometimes fibrous scarring then takes place after this much of necrosis. This can also lead to cirrhosis. Okay, so apart from hepatic encephalopathy, which is a acute state, if the patient is recovering after that, if the regeneration is taking place, there are certain things. It can be complete healing, it can be irregular liver on healing, or it can also lead to a chronic condition and will lead to cirrhosis. Now treatment. So treatment firstly is the, we are first treatment is correction of the underlying liver abnormality. If the patient is has poisoning of acetaminophen, so taking care of that, providing supportive care if it is hepatitis. Okay, so first is the treatment of the underlying liver abnormality. Otherwise, the second uh, treatment abnormality treatment the treatment is liver transplantation. So liver transplantation is the only option for the patient in which the disease is not completely resolving and other organ failure is trying to develop. So mortality rate, if of hepatic failure, fulminant hepatic failure, is around 80% without hepatic transplantation and is 35% with transplantation. So this has a very poor prognosis without liver transplantation, and in very rare cases only regeneration to proper normal liver is there. Okay, so this was all about the fulminant hepatitis. Do like, share and subscribe if you like these videos. Thanks for watching.